Hello, everyone. This is Sara Tyghter, Director of Education and Outreach at Global Lyme Alliance. Thank you all for joining us to learn more about COVID-19 and the potential impact on people who are living with Lyme disease and co-infections. Both are complex conditions where there are more questions than answers. Participants on today's call are especially concerned about contracting COVID-19 due to living with and managing Lyme disease and co-infections, the potential health risks and impact that COVID-19 poses for people who are living with Lyme disease, and also how to build a stronger immune system to reduce risk. Today's discussion will address those questions and more. We hope to provide clinical and personal insights into COVID-19 and Lyme disease. We appreciate the many questions that you've submitted in advance of today's webinar, and we'll try to answer as many as possible. So I'd like to welcome our panel, Dr. Daniel Cameron and Jennifer Christo. Dr. Cameron is a leading physician treating Lyme and other tick-borne illnesses. He has served 2 terms as president of the International Lyme and Associated Diseases Society, ILADS, and is also widely recognized as an author of the 2004 and 2014 ILADS practice guidelines. Dr. Cameron sees patients at his private practice in Mount Kisco, New York. And Jennifer Christo is a writer, educator, and patient advocate in Boston, Massachusetts. She is a published author who also teaches writing courses. Jennifer also writes for Global Lyme Alliance. She does a weekly column for us, and columns which have received mention in The New Yorker, CQ Researcher, weatherchannel.com, and other publications, to name a few. So I'd like to start today's call with Jennifer, and also to thank both of you for your time and for being a part of this program today. So Jennifer, you recently wrote a blog post, Corona with a Twist of Lyme, for Global Lyme Alliance. Mm-hmm. How long have you been living with Lyme disease and co-infections?
Well, first of all, thank you, Sarah, for having us and for hosting this, and thanks to the Global Lyme Alliance for having us, and Dr. Cameron for sharing your medical expertise. So to answer your question, I've been living with Lyme, Babesia, and Ehrlichia, which are 2 co-infections, since 1997, but I wasn't diagnosed until 2005. After several years of intense treatment and 1 serious relapse, I've been in remission with only small flare-ups for over a decade now. I live independently, I work, I exercise, and I socialize. I still have some sleep disturbances, I still get neurologically overwhelmed if I'm overstimulated, and I still need to rest in the afternoons. But I have a great maintenance routine that includes low-dose medications, including hydroxychloroquine, which is one of the drugs being tested as treatment for COVID. And I also take herbal supplements, I follow a special diet, I have good sleep hygiene, and I do some adjunct therapies such as integrative manual therapy and neurofeedback. And that whole routine has enabled me to shift from surviving to living to thriving in the context of chronic illness.
Good to hear. So what were your initial symptoms that made you think you had COVID-19?
So my COVID-19 symptoms came on really suddenly. I had actually been feeling so well early in the week of March 9th that I was planning on going skiing with friends that weekend. But on Wednesday, March 11th, I had emailed them excitedly with our final plans. And literally 10 minutes later, I had to write them all back and say, I'm suddenly projectile vomiting. I don't think I can come this weekend. I thought it just might be food poisoning, but the vomiting subsided quickly, and then the following evening I had a low-grade fever. And then Friday morning I woke up with a dry hacking cough and shortness of breath. So I was immediately concerned about COVID, knowing that those were some pretty typical symptoms, and also knowing that, I have these underlying conditions. So I called my primary care doctor who had me come in. She tested me for the flu, which was negative. She also did a peak flow test, which measures airflow out of the lungs, and that was low. So she suspected it to be COVID-19, but it took another 6 days for me to be able to be tested.
Right, and you had quite a journey to even getting tested.
Yes.
But then after all of that, and you can feel free to share your experience, the test still came back negative for the COVID, right?
Yes, so it was quite a production just to get to getting a test and to get there. And I wrote an article for the Boston Globe about that, which people can look at to follow up on that story. But after all of that, the test came back negative. I was really surprised, but my primary care doctor told me that there have been a lot of false negatives. I think now they're reporting that the test has a 30% reported false negative rate. And anecdotally, I've just heard of stories of patients on ventilators with COVID symptoms who tested negative, or a family where 8 people in the family are sick with the exact same symptoms and 7 test positive for COVID and 1 test negative. So, there seem to be a lot of false negatives. But my doctor also suspected that the fact that I'm on hydroxychloroquine all the time may have skewed my test results. In one study, patients who were positive with COVID-19 and took hydroxychloroquine then tested negative between days 3 and 6 of illness. And I was tested on the 6th day of symptoms. So had I been tested at the onset of symptoms, the result might have been different. And then finally, just clinically, I had and continued to develop every symptom of COVID-19. My doctor said if it were something else, I'd likely feel better in a week. But if it were COVID-19, it would hang on. And now here we are 5 weeks later, and I'm still sick.
Wow. So you were basically diagnosed clinically.
Mm-hmm. Yes.
Yeah. And we'll ask Dr. Cameron more about the diagnostic testing in a little bit later in the call. But so would you share with us the progression of your symptoms?
Sure. So after that first week, my fever broke and the cough and the shortness of breath started to get better. But similar to Lyme, the tricky thing about COVID we're learning is that just when you think you're getting better, it can come back and nip you in the heels. And that's exactly what happened. After 6 days without fever, my fever came back. My cough got deeper and more frequent. The shortness of breath came back as well. And then halfway through week 3, I lost my sense of taste and smell. And the fever has now left and come back 5 times now. Despite these up and downs, I can chart slow progress over these weeks, just as I could with my Lyme recovery. Now, when the fever does come back, it's lower than it used to be. The shortness of breath is much better. For example, I taught a 3-hour class a couple of weeks ago on Zoom, and my lungs got really sore and I was coughing a ton. And I taught that same class just this past week, and my lungs weren't sore at all, and I was only coughing a little. I used to get, in the beginning, I got really winded if I exerted myself at all, just unloading the dishwasher, which used to be really hard in my Lyme days as well. But that's all getting better. Overall, I have better energy. I'm feeling less sick. And the most exciting part is that my taste is coming back. Just last night, I made pancakes for dinner and was able to taste them. So that was really exciting.
That's great.
Yes. I'm hoping that smell will follow suit soon. This is day 36 today, and so I'm hopeful it won't be too much longer.
That's great news to hear. I'm glad to hear that you're getting better.
Thank you.
And so Dr. Cameron, so Jennifer mentioned that she tested negative on her COVID-19 test. Do you think the use of her on the hydrochloroquine had anything to do with those negative results?
Well, first of all, thank you for having this important issue be brought up, because I have so many Lyme patients that are calling, are worried, are concerned, because they've been through so much. And so I thought having Jennifer on, who's so articulate and writes so much for Global Lyme Alliance, it's great to have a description of what it feels like. As a doctor, when we're looking at testing, we've been pretty disappointed in Lyme disease testing. It's never as reliable as we'd like. But even in these viral tests for COVID, there are many different tests. So the actual measure of a virus, the viral count, depends a little bit on where the swab is. Did the swab go to the nose? Did it get in the right place in the nose? Did the swab give enough of an analysis? Because they've shown in like China that that the virus can be other places, like it could even be in the stool. So having a negative is pretty common in all viral tests, not just the COVID. So I'm not surprised that it didn't show up there. Now, the other thing in the news lately is the antibody test. An antibody test is often fairly predictive of a virus, and so that isn't available yet. But for now, Jennifer will just have to go clinical. A lot of Lyme patients are getting diagnosed clinically all the time. But I expect better blood tests in the future about antibodies to prove that Jennifer's been exposed.
Do you think our current treatment regimen may have lessened the severity of her COVID symptoms?
Well, this whole issue of hydroxychloroquine, which is marketed under Plaquenil in the United States, it may make a difference. But it's, you know, when I look at the studies in France, there was a slight reduction of the viral count doing a swab of the nose. But it was often a reduction compared to another hospital. So it wasn't the design that we need. We just don't have the good data on how reliable that swab is. We don't have good reliable information on the Plaquenil. So it may have helped her, but in people I've talked to, she seems pretty to have the same issues that everybody else has. You know, I haven't had anybody yet that's been hospitalized, but I certainly have patients who've had Lyme disease who are struggling the same way, and they're struggling partly because of how severe it gets at days, but also struggling through the recurrences, the day after day of being sick. They haven't been sick that long, well, except when they've had Lyme disease, of course, they could be sick for months at a time. But you can see if Lyme, you're sick for months, and the COVID, you're sick for 10 or 14 days, even 10 or 14 days seems like a long time.
Right, right. Would you say people who are living with Lyme disease and co-infections, are they considered to be immunocompromised?
Well, I think immunocompromised is probably the best way of saying it, because they're not how you traditionally define immunosuppressed, because they're not on steroids, they're not taking these biologicals that lupus patients take. So immunocompromised means their immune system is a little different. You know, we know from Lyme disease and a lot of the co-infections that are out there that the immune system is often over-responding to the Lyme, overactive. And the cytokines that are involved in the inflammatory system can be very involved, very over the top with COVIDs. But it's also pretty high in Lyme patients. So there's a lot of concern among Lyme patients if they have this much disruption in their immune system. Will the added COVID make it worse? So far, when I've been talking to patients, there's a range of people who were really sick. Some were not so sick, but I haven't seen anybody progress yet. If they did progress, I might not hear right away because I have a community-based practice. I don't have a hospital base where I might see a Lyme patient.
Right. So would you say that someone that does have Lyme and a co-infection are at greater risk for contracting COVID-19 over others?
I'm not sure. I'm not convinced that Lyme patients are more likely to get COVID. They certainly can get sick, so they're fearful of going through another serious illness. And I think that's appropriate. But I'm not sure they're more likely to get COVID. Whether they're more likely to get severe COVID or get pneumonia, we just don't know yet. The best thing is just avoid COVID, do whatever you can to avoid that infection, because I don't want any surprises down the road that COVID and Lyme don't mix. They're just not the data yet, just the concern. But Jennifer, you must have concerns. Could you describe some concerns as you went into the COVID with all you know and all you've written about the immune system problems with Lyme disease.
Yeah, certainly that was, my initial concern of why I think under other conditions, if I had vomiting or fever, I might have waited a few days to call a primary care doctor, but my concern right away here was knowing that I am immunocompromised and, really wanted to find out about right away. And that was where the concern stemmed from.
There's also your Babesia. So
right.
In Lyme disease, there's so many different types of bacteria that are in a tick, and Babesia is a parasite that it's hard to have one immune response for Lyme patients. There's quite a diversity. And there's people with Lyme disease who do well rather quickly, and there's people that do poorly. And so we're hoping that with all the attention to cytokines with COVID, since cytokines give troubles to Lyme disease patients, there'll be more research on the role of cytokines in all of these illnesses. That good people will solve some of the mystery of what's going on with cytokines. Now, there's a lot of different kinds of cytokines. So the cytokines that are talked about in COVID, even they're not all the same. There's quite a mixture of inflammatory cytokines.
Excuse me.
Thank you for that. So Dr. Cameron, would you, for people who have had Lyme disease or had a history of Lyme disease in the past, do you think there's, if they contracted COVID-19, is there concern that the COVID-19 will reactivate their Lyme disease symptoms?
My experience with Lyme disease is that stress doesn't help. So you should manage stress. So one of the stressors is to get ill. The other stressor is just being scared of being ill. And so there's a lot of concerns also with the economy. So when you get all these extra stresses all occurring at the same time, and you have somebody with Lyme disease where they're susceptible to stress, is that I counsel them and talk to the patients that I have to try to pace themselves. They've learned a lot when they've had Lyme disease on how to deal with an illness. They've learned what it's like to be isolated. They've learned what it's like to have doctors not know all the answers. And so use all those things that you've learned. So Jennifer, have you learned a lot when you've had Lyme and Babesia that helped you as you looked at COVID-19?
So much. I think that, really everything that I have in my toolkit from all those years with Lyme and Babesia has really helped me to get through these 5 weeks. As you said, Lyme patients have experience with social isolation and with lots of unknowns about an illness and lots of ups and downs with an illness, with faulty tests, and with just sort of, waiting to get better, with economic loss, all of those aspects, I've had experience with and many Lyme patients have. So I think having been through that, I've learned resilience and I've learned perseverance. And that's really helped me to get through, okay, I've been sick for 5 weeks and that's a long time. And, but I've done this before, and I know I can get through it. I've been isolated like this before. I know I can get through it. So while I know that, Lyme patients are rightfully very concerned about getting COVID and they're nervous and they have that anxiety that you talked about, I hope that I can also reassure them that they also sort of have a leg up on people because they have done this. They, have been through the isolation and they have been through a confusing illness and they have been through the unknowns and have probably gained a lot of strength and a lot of knowledge about their own bodies too. I think as Lyme patients, we're very in tune to what's going on in our body. And I can tell immediately when my fever is going up to 99 because I know the difference in my body. Then I go and I take the, temperature and that's exactly right. And I think that's true for a lot of Lyme patients. So, they know, if something's wrong, they can, hopefully differentiate between the, Lyme and some other symptom. They know how to speak up for their needs, how to advocate for their medical needs and speak with doctors. And for a lot of people right now, all of that is brand new if they've never been sick with something serious or, a chronic illness. And so You know, Lyme patients sort of already have that all in their bag, which I think is helpful.
And so that kind of segues me to my next question for you, Jennifer. Like, how did you differentiate your Lyme disease symptoms and your COVID symptoms?
That's a really good question. So for me, COVID really has been nothing like Lyme or its co-infections. I could tell I had an acute illness because of the vomiting, the cough, the shortness of breath, none of which I really ever had in relation to any of the tick-borne illnesses. In my early acute days of Lyme and co-infections, I had low-grade fever, but I haven't had that fever in years. So now when I do get one, I know that it's usually the result of something else. You know, that would be more difficult for a patient in the throes of acute Lyme disease because, you know, fever would be hard to differentiate. Is that a Lyme fever? Is that a COVID fever? But otherwise, I think most of the COVID symptoms really feel different than Lyme. So with Babesia, when I have what we call air hunger, that's a sense that my limbs aren't getting enough oxygen. Like I can feel that in my arms and in my legs. I'll get migraines because that side of my brain isn't getting enough oxygen. With COVID, none of that is happening. It's the air hunger literally means I can't get a deep breath or I have soreness in my lungs. And that's not something I've ever had from Babesia. And then the fatigue of COVID is totally different than the fatigue of Lyme. For me, the fatigue of COVID sort of feels like the fatigue of a cold. And I know it can be worse for other patients. Every single case is different. For some people, you know, it's much worse. But for me, it's been, you know, pretty moderate fatigue, mild to moderate fatigue. Whereas the fatigue of Lyme is absolutely bone crushing. I couldn't get out of bed. My body was screaming with exhaustion, but I couldn't sleep. My muscles and joints ached. I haven't had any of that with COVID. So that kind of also speaks to the question of whether the COVID has exacerbated my Lyme symptoms. And I would say that so far, 5 weeks in, the answer is no. I do think that having tick-borne infections has probably slowed my recovery from COVID. It's probably why it's taking so long, but we don't really know. But I would say the inverse is not true.
I've had one of my patients yesterday that I talked to had really bad Lyme, similar to what you were talking about, and then COVID. So he was surprised that his Lyme disease didn't get worse during his COVID. So when he emerged, he went back to work a week ago, and he was pleasantly surprised. Now his wife, who didn't have Lyme, was having a lot harder time with the COVID. So everybody has their own experience.
Right. I mean,
I'm sorry, Sarah.
No, go ahead.
It's important to point out that there are so many different levels of COVID, you know, like, you know, and I don't want to, you know, sort of discount any of the more serious, you know, there are much more serious cases. People are in the hospital on ventilators. There, you know, so many thousands of people, unfortunately, who haven't made it. So, you know, here we're talking about what for me has been a mild to moderate case. And it sounds like, you know, for Dr. Cameron's patient too, which is going to be true for most patients. But, you know, it's just, I think, important to differentiate that every case is different as with Lyme, and, you know, we don't know how it affected, but we're talking that in general, for most cases, you know, I think I'm anecdotal proof that you can have, you know, a very serious case of Lyme disease and Babesia and a pretty moderate case of COVID. And it's a slow recovery, but it's, you know, very possible to recover from that.
I'm very concerned about people who have serious illness that are in the hospital, are on a respirator, or they've been put in a coma, medically induced coma. And, you know, I used to be a geriatric doctor, and someone who's that sick, who has acute mental status changes, who's been through that serious illness, it's almost like sepsis. And so I'm concerned that when they recover and get out, is that there might be some chronic issues. We're used to chronic issues in Lyme disease, that it takes a long time for doctors to accept there's chronic issues with Lyme. So I'm particularly interested in somebody who survives COVID, that difficult COVID, how will they be chronically? Will their concentration, will their focus be back? Will they have processing issues? Because, and I think as a Lyme population, we will often be more aware of those chronic issues than your average acute physician. So stay tuned.
Right. So Dr. Cameron, the hydroxychloroquine on its own or in combination with Z-Pak is one of the treatment protocols currently for being used for tick-borne illnesses, but also being suggested to treat COVID-19. What would you recommend if someone is already on these therapies and they contract COVID-19? Do they continue on that protocol?
I think they should stay on those protocols if they're finding there's some value with Zithromax or if there's value with the Plaquenil. Now, the French study where they introduced that combination and studied that combination, they were dealing with COVID pneumonia. So it was hard in that paper, were they truly treating the COVID virus or were they treating the COVID and the pneumonia part of it? So now the nature of early research is that you'll get mixed results. You always hear in the news of somebody getting better from the combination, and then you get others who are disappointed. Some physicians are disappointed, and that's the nature of this type of infection. You don't just get worse and then it goes away. It seems like it comes back enough times, and so it's very hard to attribute recovery. But it's always nice at the bedside to make those decisions, to have every day more knowledge about hydroxychloroquine and Zithromax.
Another question that I saw come in quite a bit was around stopping the Lyme treatment, and while people are trying to just avoid being exposed to COVID-19, like just giving their body a rest. Is there any merit to that?
Well, I think that that's still up to the physician. So the physician who's prescribing it can make those choices. Whereas in my case, if they're having stomach troubles, they're having diarrhea, which is Jennifer was talking about, time to hold the antibiotics, hold that treatment. If they're tolerating it, Lyme can be a long-term illness for some patients, whereas COVID can be 2 weeks, 4 or 5 weeks. And so I don't feel that I should back off from Lyme if they're tolerating the medicine.
Okay. And so earlier you mentioned cytokines. Can you just help us understand what is a cytokine storm?
Well, the immune system, we used to call it like fight or flight or adrenaline, and but over time you get to know a little bit better what's driving that immune response. So there's an awful lot of cytokines, and there's something called chemokines that carry out the inflammatory process. And so at the study in Johns Hopkins, they were looking at about 70 cytokines and chemokines to try to find out which one was more predictive of illness. So it's such a complicated illness. We know that the cytokines talked about in COVID pneumonia seems to affect the alveoli, which is the sacs in the lungs. And I wouldn't be surprised if there had something to do with the heart and the kidney, but I don't know exactly which cytokines are causing which damage, other than that it certainly brings cytokines to the forefront. Almost everybody in the world has heard of cytokines now, and Lyme patients have been hearing about cytokines for years. So we just have to learn more about cytokines so we can avoid the COVID crisis, but we can also hope perhaps understand what's going on with a Lyme disease patient.
Right. I mean, would you say that there's some parallel between how they're looking at the COVID-19 virus and Lyme disease and some of the other tick-borne illnesses in terms of treatment and approaches and diagnostic approaches?
I think there's a lot to learn from the Lyme disease community, because we know that it's usually underappreciated. Lyme disease is hardly ever on anybody's radar until they actually get it. So the fact that it took a while for the world to mobilize around a pandemic is not a surprise to a Lyme patient. I mentioned that nobody really truly understands. I think maybe with Jennifer's description, you get a better idea of what's actually going on, and it's a compelling type illness. But I think as we get to know Lyme and its effect on the whole immune system, right away we're already tuned in to the whole immune response with the COVID. And I'm just reminding people that long term, there may be some chronic issues that need to be addressed, and we'll have to stay tuned what happened to COVID and the whole immune response over time after taking such a hit.
And so just finally, another path, what are your thoughts about the COVID vaccine for people who are living with chronic Lyme disease?
Well, the vaccine was disappointing for the Lyme population because it was introduced 2 decades ago. It seemed to prevent rashes. It wasn't as clear how good it was at preventing other Lyme. So that even the package insert said that there were plenty of people getting sick despite the vaccine. They may not have a rash, but they were sick. And there were some people with the vaccine that seemed to be ill. So that was taken off the market. So when people say they want a vaccine for COVID, as a Lyme community, we're aware that not every vaccine is going to be as clear, as clean, as safe. And I think the swine flu vaccine years ago, 30 years ago or so, had Guillain-Barré as a rare but important side effect. And so, we're sensitized in the Lyme community that not all vaccines are going to be as safe and as effective as we'd like. The other thing is we know so much more about Lyme and all of the other things that are in a tick is that a vaccine against Lyme doesn't necessarily going to work for Babesia, Ehrlichia, Anaplasmosis, Bardella, or any of the other things that come up, or Powassan virus. And so we might run into troubles with the COVID that are all strains the same. Will there be other strains? And, and that always takes a little bit of time to see what vaccine seems to work for the greatest number of COVID patients over time.
Thank you for that. And so Jennifer and Dr. Cameron, I have questions for both of you. So what do you think are the most important things chronic Lyme patients should do in general to build their immune system to help them achieve better health in the long term? Jennifer, what lifestyle changes and supplements that you found to be helpful for yourself, and tips?
For the Lyme or for COVID, or both?
Both.
So for Lyme, and in general, I've done a lot of immune boosting supplements, which are different for everyone. You have to talk to your LLMD, but I've been on a gluten-free, sugar-free diet. I have done some adjunct therapies, making sure I get really good sleep. And all of that is still really important, I think, just for boosting your immune system with COVID, either as preparation or if and when you get it. I think the most important thing that a Lyme patient can do before they get COVID is to talk to their LLMD and their Lyme literate medical doctor and ask, is there anything I can do to increase my immune system? If they're on immune boosting supplements, should those be doubled? Should they be adding something new? My doctor, as soon as he heard that I had COVID symptoms, had me increase some of my supplements, had me add some. And again, that's different for every single patient. Every patient reacts differently. Everyone's got a different medical history. So it's really important to speak with your own doctor about your own case. But, I think that's something that people can be proactive about in talking to their LLMD now of, is there anything I can do preventatively? And then also, if I were to get it, what would you recommend I do? So that there isn't this panic when you first get sick. And then I think, the other two most important things that is true for across the board is that, first of all, stay home. It's the best thing you can do. stay home. And if you absolutely have to go out, making sure you're doing the right precautions of wearing a mask, wearing gloves, sanitizing everything, washing your hands. But, absolutely just staying home, I think is the very best thing that people can do.
Right, social distancing.
Right.
Dr. Cameron, what would you suggest in terms of what people can do, like dietary changes and supportive therapies that they can do to, one, if you're someone that's living with chronic Lyme, and then also to help if you do have COVID or to reduce your risks of COVID?
I think that Jennifer laid out how much you can learn from when you've had Lyme before as to what's worked for you. So I try to stay away from processed sweets, stay away from alcohol for sure, take probiotics. But past that is some people have already learned that if they stay away from gluten or dairy, it works. Sometimes it doesn't work. Staying away from stress is useful, but and that's pretty tricky, how to manage stress in a crazy world with a crazy virus. And you're not only worried about yourself, but you're worried about grandma, you're worried about your kid. And so how to learn how to handle it. Now, sometimes Lyme patients have often found a way to pace themselves, no matter how hard it is. So how can you pace yourself with Lyme disease? And then how do you pace yourself with COVID so you can get through each day, one day at a time? And I think that's the principles. Some people find that supplements are helpful, and others find that integrative type medicine isn't so helpful. But what I do is you work with what you got and what you know already, and just hunker down and stay at home and try to do social distancing until you get through it. And you want to, since you don't know for sure what's COVID's, you might have to wait for an antibody test to prove that you've had it. So that way, if you've had it, then you hope that that's enough protection for your future.
Right. And you mentioned stress. So how do we address anxieties? Like Jen, did you find anything that really worked for you around, the anxieties of being associated with the COVID-19?
I think the first thing is to just accept that it's okay to be anxious. Everybody's anxious right now about so many different things, about getting sick, about their families, about their finances, when and if they can go back to work. And so I think, the first important thing is to accept that anxiety is there, and that's okay. But then the next step is that we can't live in fear. Spirochetes, the Lyme bacteria, they love fear. And they love stress, as Dr. Cameron said, so we don't want to give them that feeding ground. And so I think it's really, really important for Lyme patients to not give into the fear and let the anxiety and stress override them in such a way that it does rile up their Lyme symptoms. And with Lyme, we have some of the same issues where, once someone has had Lyme or is worried about Lyme, as most people are, you can therefore have a fear of the outdoors, but we can't live that way because you can't live your life in a bubble and you want to enjoy your life. You can't have a fear of the outdoors. You just have to be practical. We have to be practical about using bug repellent. We have to be practical about wearing the right clothing, about staying on paths, about doing tick checks. And so with COVID, I think it's the same thing, where we can recognize the anxiety is there, but then we have to be practical about what we can do about it. And, the answers there are staying home, washing, talking to your doctor, but just, not letting the fear overtake you. And, if I can give any hope to people from today, the one message takeaway, my hope is that it can show people, Lyme patients, that even if you do get COVID, it doesn't immediately spell disaster, I'm someone who's had, as I said, serious Lyme disease and babesia, and I've had a fairly moderate case of COVID, and I'm getting better. I'm getting there. So it doesn't immediately mean that it's going to be disaster, even if you do get it.
Right, and that's reassuring to hear.
I want to share something on that, is that because of the social distancing, staying at home, I've already had a number of my patients in practice get a tick bite. And are calling, I'm doing virtual medicine, telemedicine to take care of them, but it's like no good deed goes unpunished. So all these extra hours with their family, and then even their dog is out there a little more picking up ticks, and so it's very important that as you stay home, that you remember a new case of Lyme is certainly not going to help. So I have to walk people through that extra anxiety, and in that case, they actually are getting anxious about the new tick and a new problem, or new potential problem.
Right. Well, prevention is important, and people really need to remember to be tick aware, especially at a time like this where I think more and more people are going outdoors and hiking, and their pets and family, everyone is going outdoors. So doing your daily tick checks, using repellent, permethrin, those sort of things, practices that you should be doing every day is really important at especially at a time like this. So so I'd like to open this up to the questions that are coming in over our chat. So there are quite a few questions here. So there's one around, is it possible that the immune system is so low that it doesn't recognize and react to the COVID virus, therefore not reacting with a fever?
I think that we don't understand enough about the immune response to Lyme disease, and we've been at it for 40 some years. And every time someone looks at that immune response, it's easy to see that there's so many cytokines and chemokines and so much of a reaction. It's hard to just lump it as immunocompromised or immuno-altered or whatever you decide to call it. So that's why, are they immunocompromised? Is their immune system down? Most of the time it's actually elevated. They just feel exhausted, they feel drained, they feel like they can't handle anymore. So since most of the problem is an overreaction, we're seeing that overreaction in the cytokine storm. And so, but yet they're drained and exhausted. So we need to know a lot more about the role of the immune response for Lyme. We certainly need to know a lot on the COVID. And it seems like the immune response in COVID changes from maybe an underreaction of the immune response, even in the average patient. Then it goes into an overreaction and damages the lung and damages the body. So that's what I've been reading, is that even in one person, you'll get a changing in the immune response. So that's why maybe the blood tests aren't going to be as reliable, or maybe the normal markers of fevers, normal markers of the chest aren't as reliable.
Okay, and then, so someone asks about if your job requires you to actually be physically on site, and you do have chronic Lyme condition, I mean, would you recommend that they take a form of medical leave in order to social distance?
Well, I think that it seems like to save lives in areas like New York, maybe Michigan, you don't have much choice but to stay at home whenever you can. Now, I know some people that seem to have essential services who can modify their days so they can be at home most of the time. But it's I think it's pretty important, even though it tears me up that the economy is in trouble, that personal families are in trouble, that kids are in trouble with school. Not every kid adapts to school in the same way. And so, but these struggles that we have now, my mother is 90 now, and in the facility in Minnesota, she's great. Her faculties are good, but they're all hunkered down too in Minnesota. And just when I think they're safe, South Dakota blossoms with tons of cases. So it just seems like it's the best time is if they can stay home, if they can stay away from many other people, that until we get a better idea of it, that's wise counsel.
So there's A question around giving plasma if you've had COVID and or Lyme, I believe.
Well, there's all kinds of proposed treatments that are out there for Lyme disease, and there have been for years. And so when we hear the plasmapheresis type proposals for a virus like COVID, there's a natural curiosity as to whether that's going to be useful. It seems as they've been trying it on particularly severe patients. And so I've been busy reading, trying to understand whether that helps any patients. Hopefully that they'll get some ideas pretty soon as to whether that's helpful.
Okay. And thoughts on an O blood type with Lyme and in consideration of COVID?
Well, the blood type issue came up in a blog I wrote a couple of years ago, that if you put a tick in the middle of a petri dish and they had a choice of going to a drop of type A blood, AB, or O, that they preferred like type B blood. So, and that's just in a test tube. So, I wrote up a blog saying what blood type do ticks prefer, and so, and that research came out because malaria, there was, I think type O was they had a different outcome than other types. So they thought if something that happened with malaria happened to Lyme patients, then of course the question is, will blood type affect the COVID virus? And I don't think we know yet, other than it's a good question.
Sorry about that. So there's tons of questions pouring in right now. Questions around Babesia and COVID. With Lyme and babesiosis along with COVID, I'm on IVIG monthly. Might I be at more risk with this? With all this said, or hopefully in better position due to IVIG? Also, I have low white blood count.
Well, the white count is low in Lyme disease patients all the time. It's often low in viral illnesses. So when you have a low white count, in this case, from COVID, they might already have a low white count from their Lyme disease. So whether that means anything, we don't know. IVIG has been used with Lyme patients who have an inflammatory response. And sometimes it helps some patients. So if it's helping and you're in the middle of a COVID illness, I would typically say stay with it if it's helping. But whether to jump into IVIG at this point, that involves going and having an intervention, having an extra nurse come in and working with the doctor. And so I wouldn't jump into it now, other than it's, they'll have to study it after the fact and see if IVIG had any effect on your immune response.
Okay. And is there a test available that indicates cytokine levels?
Cytokine levels can be done, but they change so fast and so quickly. It's hard on a person to know what to do. So you can order cytokines, and there's also so many different kinds of cytokines as which one to order that'll have value. So it's I don't think it's worked out what to do. There are cytokine panels that you can order, but how does that affect your treatment plan? Some people order those things, and but I treat clinically, and a lot of doctors treat clinically without the cytokines. I think when you do research on groups and you look at the overall cytokine levels with post-treatment Lyme disease syndrome, and you look at people who are healthy, the cytokines are really quite high in the post-treatment Lyme disease syndrome. That makes me worry that post-treatment Lyme disease syndrome, that there's an active infection going on, and so I worry about those patients. I'd rather look at them a second time and see whether there's a persistent infection rather than just assume it's just an immune response.
Thank you. And so there's a question for Jennifer. Are you on any treatment for COVID now? I think you talked about that in your.
So I was already on hydroxychloroquine. My doctor did have me double my dose. Again, that's something that's different for everybody. So I don't want people to just, take that and do that. I can't give medical advice. Something to talk to your LLMD about. But that's something that my doctor thought would be appropriate for me, would be to double my dose, my standard dose of hydroxychloroquine. So that's what we've done. I've been on an inhaler, which really, really helps with the shortness of breath. And the lung soreness. I've been doing that every 4 hours basically since I've been sick. Taking a fever reducer, if you can take Tylenol. I happen to be allergic to Tylenol, so I haven't been taking a fever reducer. Rest, of course, similar to Lyme. And then the thing that has been the biggest for me is fluid. It's amazing to me how dehydrating this virus is. I'm someone who always drinks a ton of water anyway. People always make fun of me for always having my water bottle with me. And I've been so dehydrated from this illness. Like I call it the lizard disease because we shed virus, and also I think of like a dried up lizard. And that's what it feels like to me, like you're kind of drying up from the inside. And so I've been drinking a ton of electrolyte and enhanced water, running a humidifier 24/7. And still feeling really dried up. And I've talked to a lot of COVID patients who have said that same thing. So just, making sure that you have fluid on hand. And then, I've taken cough syrup sometimes at night to help with the coughing. I did develop some sinus congestion in this last week, and my doctor and I weren't sure actually if I had maybe developed a secondary sinus infection. But I'm talking to more COVID patients, it seems like that can be a symptom, and I've just taken a regular decongestant, and that's helped to clear that up. So really it's, over-the-counter medications and your typical rest and fluids, inhaler, if that, works for you, and just, monitoring all of that at home as best you can. The goal is to stay out of the hospital and away from the hospital, and so you want to try to have those over-the-counter things available to yourself at home.
Right.
I thought I'd mention something about the hydroxychloroquine or Plaquenil that you were just mentioned. Is that when you double it, it was only because 200 milligrams, I think you said 200 milligrams once a day.
Right, that used to be my standard.
Doubling means it went to the dose that Lyme patients are familiar with, which is 200 milligrams twice a day.
Right.
And but in France, they were using 600 milligrams of hydroxychloroquine for a short period of time. Now, hydroxychloroquine, as the dose goes up, there's a concern that it affects the eyes, it affects vision. So I'm not sure in the short term how much of an effect it has on the eyes. We're just cautious on using it long term for someone who has Lyme disease or lupus. And so I wanted to mention about dosing.
Yeah, that's a really good point, because my usual dose is low, and doubling for me meant just going actually to a regular dose. And I do have my eyes checked every 6 months, so I know that can be a concern with COVID. Also, the heart rate can be not COVID, sorry, with hydroxychloroquine. Also heart rate. So that's why I think it's really important to make sure you're under a doctor's care who says yes, that's what you should take. Instead of people just sort of asking for it prophylactically, because people can react really differently to medications, and there are certain risks, and so it's really important that you have a doctor who knows your full medical history and knows if that would be an appropriate medication for you.
Right, and that's important, Dr. Cameron, to point out, right? Going on a treatment such as hydrochloroquine, you really need to be careful, as Jennifer had mentioned, about the side effects, because the side effects can affect your heart, your vision, and that sort of thing too.
Yes.
And so, Jennifer, someone asked, are you currently journaling and blogging about your journey with COVID?
Yes, I have written 2 blogs about it for the Global Lyme Alliance website. One was up a little while ago. It's called Corona with a Twist of Lyme. And there's a part 2 coming up shortly, probably sometime this week will be out. So there'll be another update coming.
All right, thank you. And so we're getting some questions around supplements or anything you can do to reduce cytokine levels.
Well, on cytokines, we still don't understand what we need to know. So a lot of integrative medicine doctors have been trying different things for touching the cytokines, the whole inflammatory process. And so, you know, that's a lot of trial and error. So right now, we just don't have much science. So therefore, it's trial and error. People are doing things to try to get a handle on what might help. Now, in China, there was some herbal medicines they had proposed, but you know, the research isn't there. The data, at least, isn't available. I know some integrated medicine people are saying, well, maybe we think this might work or that might work in people who have Lyme disease. But the question is, do they work in COVID? Or if they do work in COVID, are they working to prevent the disease? Are they working after you get the disease? Or are they working after you get severe disease? But it's a complicated time because the more medicines you take, there's interactions of medicines, interactions and side effects. And so what they can tolerate when they're throwing up or what can they tolerate when they have diarrhea gets complicated. And so I think that, you know, you do what you've learned. If you've been sick in the past, what have you learned that's helped you in the past, and try to stick with those tried and true remedies if you found value. And work with your doctor to see if you should modify anything. Every doctor is kind of on edge right now trying to learn something that they can share with their patients, or they can, and Jennifer's sharing through a blog, because we can't always rely on everything being hardcore, you know, hardly researched and solid evidence. We're still somewhat moving through it, knowing that there might be a few idiotic things that are done over time that you say, what was I thinking? Well, I was thinking at the time, are you what you have? What evidence do you have?
Right, and so I just going to pivot, and there's another question around vaccine, and wanting to understand the difference between a vaccine and the flu shot.
The flu shot is interesting, is that, you know, you think that you should be able to prevent flu, that they've been having vaccines forever on the flu. But every year they say, well, we missed it. We didn't have as good a flu shot as we'd like to have. The flu shot's elusive. It keeps changing all the time. And so it's never very satisfying, the whole flu epidemic, the flu vaccine. And so, you know, there's a lot of study now on, will the COVID be as complicated? Will the immunity last? Will you have to do a vaccine every 3 years, or maybe sooner, maybe later? Will one vaccine prevent at least severe cases of COVID? So I think that every question we have in influenza comes up with the coronavirus.
All right, thank you for that. And we have way more questions than time. Are there, if there's anything?
So one thing I do want to say to that is that for my next blog post for GLA, I'm going to be answering questions that we didn't get a chance to answer today. Of course, also, I'm sure I won't be able to get to all of them. It's great that we have so many coming in, but I will be doing that for my next blog post. So hopefully we'll get a few more of those answered.
And I've been writing blogs on Lyme disease at danielcameronmd.com, but a lot of them lately have been dealing with COVIDs. And then some of them have to deal with COVIDs and Lyme together. So just like Jennifer's exploring the topic, as a writer, I'm exploring the topic. Global Lyme Alliance is also exploring the topic. So I appreciate you having the two of us here today to explore this this timely topic.
And thank you both for being a part of this program. You know, based on, you know, the feedback and all of the tremendous responses, I'm really encouraged to do more programs like this in the very near future. I just want to remind everyone that's tuned in to, you know, as we talked about before, prevention is key. And, you know, be tick aware and make sure when you are going outside, you take the proper measures of using a repellent, doing your tick checks when you get inside, putting your clothes in the dryer immediately to kill ticks, and just really be safe out there as you're safely social distancing, but, you know, also just getting out of the house and getting some fresh air. So if you'd like to learn more about being tick aware, visit our site, betickaware.org. And this webinar is recorded, and we will have it posted on our website in a few days. So, you know, stay tuned if you'd like to come back and listen, and we'll try to get answers to the questions that we were unable to answer today. Mm-hmm. So thank you all for your participation. And thanks, Dr. Cameron and Jennifer. Jennifer, thank you for all the blogs that you're writing. And also, please do stay tuned for her second follow-up on her Corona with a twist of Lyme.
Yeah. Thank you. Thank you for organizing this for us, Sara.
Oh, no worries. It was fun.
And have a good evening, Sara.
Thank you. You too. Take care.
Okay, take care, everyone.
Bye.
Bye.